On today's episode, we are taking this opportunity to sit down with Lindsey Keenan and talk about mental health. So stick around and let's be better athletic trainers. Before we start, I would like to take this opportunity to thank this episode's sponsor, Rothman Orthopedics, for their support of PATS and athletic trainers in the state of Pennsylvania. For more information, check them out at rothmanortho.com. Lindsey, thank you so much for coming on the show. How are you this morning?
I'm great. Thank you. Thank you so much for having me. I'm really excited.
Super excited to talk about this. We're a little late on the mental health. Last month was obviously Mental Health Awareness Month. This is the June episode, so we're a little bit behind the time, but I think coming through the month, getting ready to plan and get this out is going to be awesome. But before we get into the main topic, tell us a little bit about yourself. Where are you from? Where'd you go to school? What setting do you work in? Some fun stuff.
Great. So I am actually from New Jersey, but I've now officially spent more of my life in Pennsylvania than in New Jersey. Small tier, but no, my heart is in PA now. And fun little plug here, and I'm not trying to be too nerdy, but PATS has had like a really big role in that, in me falling in love with PA, mostly because of my experience starting at Lock Haven. So I did my undergrad degree in athletic training from Lock Haven with Adam, and so we both graduated together. So we're longtime friends, and I finished my degree there and went on and earned 2 master's degrees from East Stroudsburg University, one in sport management, one in athletic training. And then I taught at ESU for a few years and was able to travel, helped teach at University of Puerto Rico, did some really cool things there. And then that's kind of when I decided that I wanted to continue with teaching, get my PhD, and focus on mental health. That was something that I knew I wanted to focus on and I was really passionate about. So I got my PhD from Temple University in kinesiology with a concentration in sport and exercise psychology. And from there, I went and taught for a year at California University of Pennsylvania. You might be seeing a trend here, lots of state schools. I love the state system. What can I say? State education, it's great. And I taught in their athletic training program and worked with the men's basketball team. And finally ended up landing at Westchester University, where I'm hoping to stay for a very long time. I'm loving it here. I'm an associate professor in the Department of Sports Medicine. I teach in our undergrad and graduate programs, and all of our faculty work clinically as well. So I'm the athletic trainer with the NCAA women's rugby team at Westchester, and so I love that. We also conduct research, and so there's a research component part of my job as well, which I really enjoy. So that's where I am. And I'm also a mom of 2. I have a how old is she? Goodness, 3.5-year-old, and daughter turns 1 next week. So
wow.
1-year-old and a 1-year-old. So that's me. That's me in a nutshell. And I'm married to
not going to mention the.
What's that?
You're not going to mention the dog, a mom of the dog as well?
Oh, yes. Sorry. Yes. I also have a wild dog, a Weimaraner named Summit, because I like to ski and hike. And I'm married to an athletic trainer as well. So.
Oh, God bless your family there.
Nice. So, Lindsey, today's episode, as Phil said, is going to be focusing on mental health. And when we were talking about finding somebody to come on the show and talk about that, you were one of the first people that came to my mind. So I appreciate you coming on the show and sharing your passion with us. That being said, what made you want to focus your energy on the mental health of your patients and athletes?
That's a great question. Yeah, and thank you again for having me here. I love talking about this topic. There's been a number of people that have influenced my life and my career to focus on mental health. One of those people who couldn't be on the podcast today, but is also a big advocate for mental health in athletes in Pennsylvania is Dr. Yvette Ingram. And she, was my mentor and professor, and now is a very good friend at Lock Haven. And she, teaches sports psych courses there. She actually motivated me to get the same degree she has from Temple University because that was something she was really passionate about. In addition to that, I had a unique but not so unique experience when I was at Lock Haven. When I was 18, I experienced depression for the first time. And as, a young adult, first time in college, away from home, I had no idea what I was going through. Like, I didn't know it was depression, right? We didn't really talk about depression when I was in high school. And even in college, the first semester, we didn't really talk about it. And it wasn't until my second semester, freshman year, that I was in a health class. I'll never forget it, 7 to 10 p.m. In a large lecture hall. And the professor said, open up your textbook and take a look at this checklist. And it was a depression symptom checklist. And I remember reading through the checklist and my eyes just like welling up with water because I realized, oh my gosh, this is me. Like, I have depression. And I went back to my dorm room and cried because that's what I was doing every day. Again, I didn't really know what was normal, what wasn't. I thought I was just upset because I went through a big transition, lost my grandmother, had a relationship end, and I, wasn't adjusting like I thought I would. And it wasn't until I got back to my dorm, I called my mom and said, I have depression. And of course, because I'm 18 and I can't, do anything by myself, my mom called the University Counseling Center. I got into counseling. And by the end of the semester, I was feeling better, right? So thankfully that worked for me. Thankfully, I had someone to turn to, and I was, felt comfortable talking to my mom about what I was going through. Had that not been the case, I don't know what would have happened, because if I'm being completely transparent, it was a really hard and scary time for me. And college is scary for a lot of people, but that's around the age when mental health starts to surface for a lot of kids and young adults. And I was lucky that I had my mother, but it really made me wonder, if my athletic trainer had talked about mental health, and it had nothing to do with my athletic trainer. At the time, that was not a thing. And even now, it's not necessarily mainstream, although it's becoming more mainstream for athletic trainers to talk about mental health. But I wonder, I was a collegiate lacrosse athlete. I think I forgot to mention that. And so I was playing lacrosse. I did preseason physicals, but that mental health was not mentioned. And so I wonder, had I been screened, what would have happened? I probably maybe wouldn't have gotten to the point that I was having suicidal thoughts, that I was really struggling, that I was failing some classes and my GPA was plummeting. Since I was referred to the counseling center and I did get help, I was able to turn things around, and the next year pull my GPA up, get into the athletic training program, and here I am, right? But that story could have been a lot different had I not had the path that I did. So that was one of the reasons. The second part of that is that when I was at East Stroudsburg University, one of my football athletes, his brother died by suicide. His brother was a football athlete at UPenn. And at the time, we later found out he was, at the time, the youngest athlete to be diagnosed with CTE. And I remember obviously that hitting us as clinicians really hard, and our, football team, our athletes, my athlete, who I'm still very close with today. Actually, his now wife and I were in grad school together at ESU. And so it hit close to home. And I, again, remember thinking, like, are we doing enough as athletic trainers? Like, we're talking about possibly doing cardiac screening of hundreds of athletes to find this 1 in a million chance cardiac issue that might kill one of our athletes. But yet suicide is the second leading cause of death in this age population. I think the third leading cause of athletes in general. And so it's like, that's so common. This is happening. Why are we not talking about it and doing something about it? And so that's kind of how I ended up where I am today.
Wow. Yeah. No, thanks for sharing that. It's obviously, it can be difficult to talk about that. I think it is becoming more mainstream, and people are more open to talking about their experiences, but it's still difficult, right, to admit that and say it out loud. So we appreciate you sharing that with us, and that's a big deal. So I think this episode can really hopefully open people's eyes a little bit to what's out there. So yeah.
Kind of break down the taboo of it. I mean, this is something I guarantee you almost everyone experienced it at some point in their life. I know a couple years ago I went through a bunch of big changes and started seeing a counselor, and it's done wonders for me. But on that note, what do you think or in your opinion, what are some of the most important things that athletic trainers should implement to address some mental health issues that we see commonly in the athletic training room? For athletes or for our patients?
Yeah, for our patients. That's a great question. I mean, the first thing is touching on what you both just said, like turning into yourself and saying, how comfortable am I talking about this? Right? Because this topic is stigmatized. It's taken me a long time to get to this point that I can comfortably talk about my mental health, and I talk about it openly. I've talked about it in rooms in front of 100 people, and all the way down to one of my patients right in front of me. I'm comfortable sharing, but that's probably not the norm. It's a private thing, right? It's also an invisible injury, and so you can hide it. Many people are hiding it. And Phil, you mentioned most of us will go through this. SAMHSA, an organization that looks into mental health and substance abuse in the U.S., their most recent publication just came out from their study in 2019, and they found that 50% of U.S. adults at some point in their lifetime will be diagnosed or experience a mental health issue. And so this is how common it is. 1 in 2, half of us, right? And so, the stigma behind talking about mental health is a difficult thing, but we can move past that if all of us together start talking about it more. And that is already happening, right? So the NCAA and the NATA have published papers and consensus statements saying, yes, we need to address this. I think it took a little too long to get to this point, but at least we're here, right? The NCAA best practices document wasn't even published till 2016 on addressing mental health in athletes. But now we're here, so let's talk about it. So as an athletic trainer, think about, what are my discomforts? What am I comfortable with? It doesn't mean that you have to disclose everything about yourself, but even stepping out like you just did, Phil, and saying, yeah, I've been in counseling before, 100% normalizes it. Because counseling is just like treating your ankle, right? And so if we can normalize that conversation and get more comfortable talking about it, you will help your patients, because they're going to hear you say these things and say, okay, so let me talk to her about something when I'm not, feeling right, or she's the person that I can go and tell. And I've had that happen with my athletes who, it's their 4th year, their senior year of college, and I've been screening them every 2 weeks, every athletic season, for depression, anxiety, eating disorders. And it's not till their senior year that they come to me and say, or, flag on their checklist and report all these symptoms and say, yeah, I've been feeling like this for 4 years. But I finally got to the point that I'm ready to tell someone, and you're the person I'm going to tell. And so that's not a rarity. Like this, every team that you work with, if you work in the secondary school, collegiate setting, there's going to be somebody on that team experiencing depression or anxiety. It's inevitable. And so are you creating an environment that opens the door to conversations? Now, with that being said, we also want to understand that we're not mental health providers, right? We're not licensed mental health providers. And so we can have a conversation, we can provide a listening ear, and then we offer a referral, right? We tell our athletes, I hear you, and it really sounds like you're struggling. Let me help by connecting you with the right person, because I can listen, but I'm not going to be able to help you through this. And only a licensed mental health provider is going to be able to help you through this. So having that conversation, knowing, when to bring that up, and really the answer there, because athletic trainers often ask me, like, when do I know? Should I offer a referral or not? offer a referral all the time. Literally, even if they're just having a bad day, it's just a bad day. You have some coping skills, but also there's the counseling center is always there on campus, or the school counselor, the school psychologist, or, we could call your health insurance and get you set up with someone, even if it's just for a couple of weeks. Like, you don't have to wait until things are so bad. And that's often what our patients do.
Yeah.
I'll also say that the most common thing that I hear from athletes when I do offer a referral is, I just don't think it's that bad yet.
Yeah.
I just don't think it's that bad yet. It's not that bad yet. And I'm like, how bad are you going to let it get? How long are you going to go until you give yourself permission to feel better, right? To have somebody help you. And so, it's, again, breaking down that stigma, doing follow-ups, having these conversations with your athletes and your patients. And so that's the most important thing. Once you start doing that, there's other specific technical things that many of us probably already know about, right? If you've read the NATA consensus paper on addressing psychological concerns, there's lots of resources there, and step-by-step what you can do as an athletic trainer. If you haven't read that yet, please read that document because it's really helpful. And then the second is the NCAA best practices document is literally a checklist. At the end of the document, there's a checklist that says, here are the things that we recommend you do. They, in a nutshell, include identify a mental health provider. So just like you would identify a cardiologist that you might refer, a dentist, all these different specialists, a podiatrist, along with your team physician, you should have a mental health provider on your sports medicine, on your athletic healthcare team, right? And so that's number one. That's who you want to work with. They're going to help give you guidance on developing a mental health management plan. And that's the second step. Develop a mental health management plan. That should include an emergency referral protocol, a routine referral protocol. So what are these mental health emergencies? Listing them out, and what do you do? How do you get the patient to immediate care, etc.? Having a routine referral protocol. And then lastly, when you're ready, when you have all these other things in place, a mental health provider and a management plan, you can possibly look into screening your athletes, implementing screening. It's way different than just asking your athletes a couple of questions in the PPE about history of depression, or, are you feeling down, depressed, or hopeless? Just asking one or two questions isn't necessarily screening, and you're not going to catch your patients who are actually struggling with clinically relevant symptoms of depression, of anxiety, eating disorders, etc. And so there's lots of surveys out there that you can use to screen your athletes for mental health issues.
I kind of wanted to go back to the conversation about normalizing mental health, right? And I think worst case scenario, we worry about people hurting themselves, right, or suicide or those types of things. Like, that's worst case scenario. But I don't think people also understand that mental health plays a role in your performance, right? Your ability to handle stress in general, right? So, like, do you really want to be fit and work out and crush your fitness goals? Well, if your mental health is chaotic and not in the place it needs to be, you're taking away from your body's ability to handle that stress, right? Stress is stress, and I think that's a big key element for me that I talk about with my athletes a lot, because that is my role. I'm more the performance guy, right? And if I can link that mental health to the performance, it seems to set in a little bit more. And like you said, not waiting until it's bad enough to go see counseling. Well, hey, let's go talk to a counselor and just get your performance better. Like, you know what I mean? So I think that's a big concept for me personally. Any thoughts on that?
Yeah, you're going to get buy-in from your athletes using that route. And it, I hope that we could get to a day that we don't need buy-in, right? Because, like, you don't have to get buy-in for your athlete to treat their ankle sprain, right? Or their ACL. But sometimes. Unfortunately, sometimes you're right. But unfortunately, buy-in from our patients about addressing their mental health and connecting that to performance. Absolutely. You'll see the light bulbs go off with your athlete that, hey, you want to continue to play. And usually they'll notice too, right, that their performance hasn't been at its peak. And probably has to do with some symptoms that they've been dealing with, very often sleep issues, which are connected to mental health and performance. And so if they're not sleeping, right? So, and sometimes I ease into the conversation, especially if I could tell if my patient is nervous or anxious to talk about this. They're closed off a little bit, or like, what do we need to talk about? I could tell that they're a little hesitant. So I'll start talking about their performance, and that, hey, I've noticed, that you've brought up that you're not getting as much playing time, and you've been frustrated with that, and you feel like you keep not performing like you used to. And so you, on this screening, or you've mentioned, or I've noticed that you haven't been yourself lately. And it sounds like, and then usually I bring up sleep too, because sleep is easy to talk about, right? Sleep is like part of our life, always, no matter what. So is mental health, but sleep is an obvious thing that we do. So I usually ease in with sleep, like, how have you been sleeping? And inevitably, if they're really struggling with a mental health issue, their sleep is disrupted. I mean, sleep is a hard thing to deal with, even when you're not dealing with a mental health issue. For numerous reasons. And so sleep is an easy thing to talk about. I bring up sleep. Yeah, I haven't been sleeping, or I can't stay asleep, or I'm having trouble falling asleep. Okay, these are all signs of mental health distress, right? Or at least just stress in general. And so we have that conversation about stress, and that, hey, if you want to sleep better, you want to perform better, here's what I would recommend that we do. Let's call the counseling center. And I walk them through what that experience is like. And then I ask them, like, is this something that you would consider? Would you think about this, or would you want to do this? I kind of put it on them and see what their response is. Sometimes it's, I want to think about it. Okay. All right. How about I get in touch with you next week? Let's chat next week about it. Yeah.
Yeah. That I don't want to say that just constant hounding, but that concern that we can express as athletic trainers, we have that relationship with our athletes, that building a trust that, just like getting an athlete to take care of a chronic injury. We just, hey, let's work on this day. Let's work on this day. Oh no, I don't have time. Okay, and then you just keep going and going. Finally, they're like, yeah, you want some? I'm going to take you up on that offer. And then once you get them kind of in the door, then it's like, okay, now we have the opportunity to do some real work and really help them. I think that's an awesome opportunity to take.
So Lindsey, you talked about the resources from the NATA and the NCAA document, which I think are really helpful. But, we do have a lot of listeners that are in high school as well. Any thoughts or resources out there for them, or just more resources in general for our listeners that you could share?
Absolutely. So, like I said, your biggest resource is going to be those actual licensed mental health providers, but they may be limited. The SAMHSA also came out with a stat that said 55% of counties in the U.S. have not one single practicing psychiatrist in the county. 55%. Wow. So access to mental health care is not where it should be in the U.S. And so that is one issue. And then when you also break that down into different marginalized groups, our BIPOC folks, like, people in very urban areas are possibly not going to have access to resources like somebody else might be. And so access to resources is difficult. However, you can reach out to your county health department and see what resources they do have. So even though there might not be a psychiatrist, there might be licensed psychologists in the area. Obviously, you can call your patient's health insurances to see what resources they might take. And then, your school district, if you're in a secondary school, your school district might hire school psychologists. They might not. It depends on the school district and the access. And so seeing what resources and just compiling a list, that's the place to start. Those mental health providers are then going to have other resources as well that you might not even be aware of. Right. So that's a really great starting point. The other thing is access to specific tools.
Can I interrupt you there real quick?
Yeah.
I'm just curious to go back to those resources. So, there's your mental health counselor, right? You have your psychologist, you have your psychiatrist. Could you maybe break those down for our listeners a little bit, and maybe Absolutely. when is appropriate and when is not?
Absolutely. Great question. So psychiatrist is going to be an MD, right? Or a DO. So someone who is a licensed physician who then went into specializing in psychiatry. Typically, on average, on the whole, a psychiatrist is generally not going to be the person who's going to offer counseling or psychotherapy. They are going to manage or oversee cases with their medication, and sometimes not even medication, but just overall like a diagnosis. So if you have a patient who has been in counseling, has been seeing a therapist, very often if it's if the counselor or the mental health provider feels that this person might need a little bit more than just counseling, they generally will refer to a psychiatrist, but sometimes not. And so this happens a lot. I'll screen my athletes, or they'll start talking to me about their mental health, and I find out they've been in therapy for 3 years. Okay, so, but they're still really struggling. It seems like maybe they need a little bit more. Maybe they come to me and say, I need a little bit more. All right, let's see if we could set you up with a psychiatrist. Sometimes it's that the athletes weren't diagnosed appropriately, and so they need different types of treatment, whether it's different approach for in therapy or specific medications. And so a psychiatrist can oversee medication management and some more complex mental health issues. A psychologist is a licensed mental health provider that has a doctorate and generally 5 or more years of clinical and sometimes research experience in mental health and counseling. So their focus is going to be counseling. They cannot prescribe medication. And I should mention too, very often, most of your patients, their psychotropic medication is probably being managed by their primary care doc. Yeah. And so ask them. So if they say, yeah, I'm already on depression meds, but they're still struggling and they haven't done therapy in a year, they've just been on the same meds, it's probably that maybe their meds need to be adjusted. Yeah. And I usually advocate, let's have you go see a psychiatrist, because while our primary care docs do a fantastic job, they can't be experts in everything, right? And so we want to connect them with the experts. So if they're already on medication and you find that it's being overseen by their primary care doc and they're not doing well, let's refer them to a psychiatrist. With a psychologist, that's going to be a licensed mental health provider that can provide psychotherapy, counseling, and they often will have specialties. So they'll specialize in depression or eating disorders, sometimes even athletes, right? If you've heard the term sports psychologist before, be aware. So this is really important. This is key. Be aware that literally any psychologist can just hang a shingle on their door and say, I'm a sports psychologist. There's no regulation like there is for licensed athletic trainers, right? And so that term, sports psychologist, now psychologist is protected. Only a licensed psychologist can call themselves a psychologist across the US. But there's no regulation of a sports psychologist. So you just want to find out, why does this person call themselves a sports psychologist? Do they have 10 years of experience working with athletes? They were an athlete themselves. They've worked with this team and whatever. So they understand the context of sport. There are some certifications that they can have through the Association for Applied Sports Psychology as well. And so if you hear or find somebody that's in your area that's a sports psychologist, awesome. Get in touch with them. Find out what their specialty is. Sometimes sports psychologists too, they'll focus on performance enhancement, which if you're wanting to refer somebody for severe depression, that might not be the right person, right? So you just want to find out their experience, their background. And then we also have licensed professional counselors, LPCs, who's going to do they generally have a master's degree. They're going to do counseling, psychotherapy. And then we have social workers, licensed family and marriage counselors. Social workers is going to be the referral for your patient whose parents are going through a divorce. They're struggling with their social aspects of their life. Maybe not necessarily just mental health, but other, social, financial, environmental things. And then marriage and family counselors. Sometimes if there's like family issues, maybe the whole family goes and sees a licensed marriage and family counselor to do group or family therapy.
Excellent. No, that was super helpful, because I do think that can be a little confusing with all the options out there and people not understanding and when are meds appropriate and when are they maybe not. Another question for you, you touched on it there, where you have these athletes that have been in counseling for years or maybe they're not currently in, but they've done it in the past, but just don't feel like it's been helpful. Any tips or tricks there, or like how do you have that conversation? Like they just have given up on counseling.
I'm so glad that you said that, because this is so common and this happened to me several times, by the way. So I mentioned the first time I had depression, I was 18, right? But I went through in and out of depression. I typically suffer what's known as adjustment disorder. So I'll be fine, and then we'll have a big transition in my life, a death of a loved one or a relationship end or something like that. And I just struggle with adjusting to the change, right? And so that's under the umbrella of depression. And so I've been in and out of counseling and therapy for years, although 2.5 years ago, I finally, after having my first daughter and experiencing severe anxiety and some PTSD for the first time in my life, and that was different for me from depression, I realized, like, I love counseling because it helps me so much. Well, I've been doing what I tell my patients not to do, and only getting in counseling when it was like crisis mode, right? So I finally was like, I want to be in long-term therapy. So I've been doing therapy once a week for the past 2.5 years, and I've never felt better in my life, right? But the thing that I've experienced in and out of different therapists is that sometimes you're just not going to click with your therapist. It has nothing to do with their specialty or anything like that. This is how I pose it to my athletes. And so this is a fun little trick or tip that athletic trainers can take away. I say to my athletes, after they're like, yes, I'm going to go to counseling, I'll accept the referral, what have you, I say, this is what I want you to remember. Think about your team, okay? You are not best friends with every single person on your team, right? You're not going to click with every single person. You're going to click with like 1 or 2 or 5, people on your team. And so sometimes we just don't click. We don't mesh well with other people. And the same thing can and possibly will happen with your therapist, with your counselor. And so give it a few sessions. Give it 1 or 2 sessions. You're not going to be like, yes, this is it on the first session, right? You have to get to know each other. But after 2 to 3 sessions, if you're just feeling, or a year, sometimes they get you through a difficult point, and then you're like, I just feel like I'm not making any more progress. That's okay. You change. The therapist changes. It happens. We're people. And so you should probably find a different therapist. Sometimes it's difficult because it's like breaking up with your therapist, right?
Yeah.
Understand that mental health providers understand this. They know this. They know that, and they might even be feeling like, well, maybe we're not connecting that as much, but they're not going to push you out the door, right? So I tell my athletes, if you don't feel like it's working, that's okay. You can find somebody else. Come back to me. If you feel like you can't find someone on your own, I will help you find another mental health provider, okay? Or our team physician will, or your primary care doc will. Like, we will set you up with somebody else. And I've been in the boat where actually within a matter of a month and a half, went through 2 different professionals, because at first I was referred to a social worker, and it just wasn't working. I was like, her approach I think isn't right for me. Went to somebody else. It got me through for a couple of months, and then I was like, it doesn't feel right. And then I found another therapist, and I was like, yes. And I moved leaps and bounds with feeling better and addressing my mental health and growing as a person for the next, several months working with that person. And so you will not always click with the first person that you match with, that you get set up with, and that's okay. I often hear patients say, well, therapy doesn't work for me, because they tried it once or twice with one person, and it wasn't the right time, the right person. So keep that in mind.
No, that's really helpful. Because like I said, I experienced that a lot, trying to have that conversation, and they're like, because I do think it's more prevalent now where they're identifying these things earlier on, and maybe it is too that maybe they're too immature as a high school athlete, and trying to do counseling, and they weren't ready yet, right? And then they give up on it, and that's unfortunate, because I think it can definitely be helpful, and I love your maintenance counseling, right? Like I'm a big advocate of that as well. Like I don't, and Phil touched on it earlier, but like everybody experiences stress, everybody experiences anxiety, everybody has probably some low level depression at some point in their life, and it's about you being the best person that you can be, and if going to counseling and talking through things helps you with that, like that's it's like getting a coach for anything else. Like you pay a coach to train you for soccer, you pay a coach to train you in sports performance. Like this is just mental coaching, right? Like I think we need to continue to normalize it, and agree. Like if you find somebody you really like, stick with them, and maybe it doesn't have to be once a week, maybe it's once a month, maybe it's once every 3 months. But I think checking in and staying on top of it is a really big deal and very important. So thank you for sharing all that. I did interrupt you earlier about resources. Did you want to touch back on any other resources that you wanted to talk about?
Yeah. So one thing I was going to mention is if you do decide to screen your athletes for mental health, and this is something that I have athletic trainers ask me about all the time, like, how do we actually do this? And while the NATA and NCAA consensus statements on addressing mental health are really helpful in what should I be doing, they don't necessarily tell us how to do it, right? So, hey, screen your 550 athletes for mental health. Okay, how's that going to happen, right? And so I went through this for several years where I was doing paper and pencil screening for depression and anxiety, sometimes eating disorders during preseason, sometimes every 2 weeks, because I've also tied mental health screening to my research as well, looking at prevalence of depression and anxiety in athletes. And it just wasn't efficient. Like, we wear so many hats. How are we going to convince athletic trainers to now put on another hat of screening our athletes for mental health, right? And so I remember thinking, like, we're at the point that people are recognizing, yes, this is important. Yes, we need to address this. No, I'm not going to spend 20 hours a week screening my athletes and calculating scores and learning how to do this and all of that. And so we're not going to get the buy-in from the athletic trainers to actually do this unless we have a feasible way to screen. And so I battled that for a number of years in my clinical practice, and finally was meeting with our licensed sports psychologist at Westchester University and one of our associate athletic directors, because we were looking into writing an NCAA grant to address student athlete mental health. And I had tossed around this idea in my head for a while and finally said to them, what if we developed an app to screen athletes for mental health, but that efficiently screens them, and the athletic trainers basically have to do no work other than selecting what surveys, and then the app will tell us what to do from there. And that tiny idea finally developed into an app that my two colleagues, Rachel Daltrey, Kellyanne Milliner, and I developed an app. It's now called ProMotion Health. I'm really excited about it. It hasn't officially launched yet, although we're launching this summer. We've piloted it for a couple of years at Westchester with our athletes. So essentially what the app does is allows athletic trainers to select various different mental health screening tools or any PRO, so hence the name ProMotion. So you can put in any patient-reported outcome measure that you want, and the app will actually calculate the scores for you and put them into red, yellow, and green categories. So after you send the survey to your athletes, they each have their own private login. They take the surveys, and then you can filter results by sport, by gender, by individual athletes, and it will tell you who's in the red flag, who's yellow flag, maybe some elevated symptoms, and who's green. It provides feedback to the athletes based on scores to give them connect them to mental health resources and other resources. We're actually going to be using the app as well for COVID screening potentially. So there's lots of uses for it as well. And it's just streamlining the process. So now we can screen hundreds of athletes, see who red flags, and then just add them to follow-up categories. And we can even document the follow-ups in the app as well. So I'm really excited about this. There are also, I'm going to also provide, there's other resources as well for mental health screening. If you are in the secondary school, another app that is commonly used is Healthy Roster. It's an EMR, and so you can look into that, although they might not use, as many mental health screening tools. If you're using Google Docs or Qualtrics or any other, like a SurveyMonkey, just make sure that you have a HIPAA and FERPA compliant server, because you want to make sure that your patient's information is protected, right? And so our app is hosted on a HIPAA and FERPA compliant server, so we know that the PHI, the patient health information, is protected. So there are, things out there, technologies that you can use to streamline this process.
Yeah, no, that is great. Really excited for you, and
Thank you.
we'll continue to look for your app. We are at Dickinson. We're currently using Qualtrics for our screening. I mean, it's part of the NCAA requirement, and we feel good that we're doing it. But it's complicated, right? There's a lot of boxes you have to check. We're asking about. Yeah, yep, and just asking about hurting themselves, and that's a liability in itself, right? Like if you ask a question but then don't follow up with it. So there's a lot of details that go into it. We have our counselors on site for that screening, so that way we have access to somebody if we need them. We went back and forth about like trying to do it over the summer, as part of our PPE, but like if you don't follow up with that information, like that's a big red flag. So yeah, really excited to see the app when it comes out. Did you have a timeline of when you think it might be available?
Yeah, this summer we're hoping to launch this summer. So we're launching at Westchester, and we're gonna bring. We're looking for some different universities. We're starting in the collegiate setting, but going to expand into the high school setting. It's ready. So we're just setting everything up. We're done with beta testing, and we're really excited about it. And can I share the website? Our website is
absolutely. Yeah, I was gonna ask you. Yep.
Yeah, our website is gopromotionhealth.com. Gopromotionhealth.com. So, if you're interested, all one word. So if you're interested, certainly check us out. We're really excited about it. And I do want to put a little plug here. We're an all-woman team, which I'm really proud of as well. So that's pretty neat.
That's awesome.
Yeah, congrats.
Thank you.
Lindsey, let's what are some of the misconceptions or misunderstandings that athletic trainers may have about handling a patient with some kind of mental health issue going on?
Yeah, that's a really good question as well, because we're just as a profession really starting to enter into this realm of, okay, this is part of addressing the whole person, right? And so often there are some things that maybe we might not necessarily understand, and a couple of things come to mind. The first is that I have colleagues very often from different universities come to me and say, we've tried working with our school counselor or our counseling center or, this mental health provider that we reached out to. And they were willing to work with us, but they told me that they're not going to tell us when our athletes go to appointments, or that they are in therapy or continuing therapy, or how's it going, or giving us updates. And we can't have that, because we're the athletic trainers. We oversee their healthcare, and we need to know. And this is a hard thing to tell athletic trainers, because we like to have control over our athletes' health because we care so much, right? However, you are not going to be privy to that information. Mental health providers are held to very high, stringent, confidential, and ethical standards around the healthcare of their clients and their patients. And so they're not even giving the police this information. They're not going to give the athletic trainer down the road the information about the patient, not even have they attended or come to the counseling center or, attended appointments. And that's okay. That's okay. That's what I want to get that message about, because if the only thing that we can do for our patients is tell them about the resources, connect them to the resources, and create an environment that they feel comfortable coming to you if they need to. Beyond that, we can't force them to do therapy. And by the way, even if we did, because sometimes that has happened, like you have to go or else, whatever, ultimatums, it's not going to work. Therapy doesn't work like that. No, they have to buy in, and they have to want to get better. They have to be ready. And so that's number one. We can't make them. And, we have to know that once we refer to the mental health provider and the athlete has the information that they need to be connected to this person, beyond that, it's up to that healthcare provider to treat them. Now, it doesn't mean that you can't turn around to your patient later that week and say, like, hey, how'd it go? Okay? Not okay? Can I check in? Or ask them, am I allowed to check in? They might be standoffish, like, listen, I don't want to talk to you about my mental health, or yeah, I went. They'll give you the hint, right? Or they might say, yeah, I went. Actually, it was really helpful. Also, be mindful of when and where you're asking those things, right? You're not going to have these conversations and ask these things in the athletic training facility with 20 other athletes and their teammates next to them, right? You're not going to have a productive conversation about mental health or even counseling, and you don't want to bring that up in front of their teammates. You absolutely should not. And so, sometimes out in the field, I'll just look at them and say, hey, yes, that's fine. The other teammates don't know what we're talking about, but your athlete will. Your athlete will know. And then I'll say, do you want to talk about it? Or, can we check in next week? So then we find a private space to be able to chat so I can check in, right? The caveat to that about the healthcare providers, the mental health providers providing this information is if the patient is at risk of harming themselves or others, then they will reach out to you if the patient included you as, someone that on their emergency contact list, or if the mental health provider knows that you are one of their licensed healthcare providers, like you refer them directly, right? So I've gotten calls before from our licensed sports psychologists that said, hey, so-and-so, our athlete knows that I'm reaching out to you to let you know, she's been working with me, but she is having active suicidal thoughts. She does not have a current plan, but she does have an idea of how she might die by suicide if she were to attempt. And so I want to let you know so that we are all aware, of what's going on, and so that she may be checking in with you and know that I am working with her daily or weekly or whatever it might be, right? Sometimes they reach out to family members to say, you need to get all of the guns out of your house. They shouldn't have access. Like, here's the different lethal means that they've discussed in therapy. These are scary things, but it's real, right? And so locking up guns, making sure that they're not having access to guns, because that is a very common form of someone attempting to take their life. And so those conversations might be had, but only in extreme circumstances, right? And so beyond that, you're not going to get information from the mental health provider. And so that has to be okay. Now, there are caveats to that as well, where some universities say, well, we have all of our athletes sign HIPAA forms that say that the sports psychologist or the mental health provider can contact us. I don't recommend that because, listen, research shows that athletes, if we're talking about athletes specifically, right, athletes will seek help for their mental health at significantly lower rates than their non-athlete peers. And so they're struggling, but they're not getting the help that they need because of many different things: stigma, fear that their coach is going to find out, fear that their teammates are going to find out. So if you now have them sign a paper that says, yes, the mental health provider can tell, the athletic trainer anything that they want, they're not going to go. You're not going to get buy-in. And so don't go that route. It's not necessary. When you refer them, know that if there is an emergency, you will find out about it. Okay. And beyond that, they've been referred and you've now connected them. And you can always follow up with your patient directly. Yeah. The second misconception is about thoughts about death and suicide. Very often we hear that and we're like, emergency, send them to the hospital. They need to see a mental health provider. Like right now, we can't, thoughts about death and suicide are very common for someone who's experiencing depression. Very common, okay? It's when those thoughts change to actions and intentions, okay? So there's a big difference between intention to kill yourself and thoughts about killing yourself, right? Thoughts about hurting yourself or killing yourself are still not good, right? This person is really struggling and we want to connect them with help, but it doesn't necessarily mean that it's an emergency. And so how do we find out if it's an emergency? We ask. So learning the skill of how to talk to your patient who is potentially depressed, right? You've now screened them or they told you that they're depressed and they say, yeah, well, I just don't want to be here anymore. I want to wake up tomorrow and not be here, right? That's a red flag. Okay. So are you having thoughts about suicide? Yes. Yes, I am. Okay. So have you created a plan? Do you have intentions to kill yourself? Have you created a plan? No, I haven't had a plan and I don't think I would ever do it. I don't even know how I would do it. I have no plan, but these are thoughts that are just in my head. And they're going to feel uncomfortable talking about that because it's the scariest thought you will ever have in your life, right? They're now sharing with you. So you also don't want to be judgmental in the moment. It's something that you want to practice asking and talking about to the mirror before you talk, say this to your patient. And so if they don't have an active plan and they don't have intentions, you don't have to send them to the hospital that day, but you do want to connect them with a mental health provider, right? But if they do say, yes, I have a plan, or I think I might, or I don't feel safe going home, okay, then we're going to take you to the hospital. We're going to walk you down to the counseling center. We're going to walk you to the counselor's office, whatever your emergency action plan calls for a mental health emergency. Yeah.
Scary. Like you just piqued my anxiety over this whole topic from that. And I think the reassuring part of what you just said is having that plan in place and practicing it like we practice everything else in our career. We practice spine boarding, we practice emergency procedures. This is nothing different. And as daunting as this task seems, I think that last comment right there of practicing it in the mirror is right there on point. I love it.
Mm-hmm. Yeah, I agree. It's just another emergency action plan that we have to have in place and be ready to implement. I agree, Lindsey. We've had some situations here at Dickinson that, where the athletic trainers definitely felt like the situation was much more urgent than the mental health, the mental health experts, right? Anything else? Any other thoughts on that? Like, I feel like that is really common. Like, where we're like, this kid's in here talking to me about committing or about suicide and hurting themselves, regularly. They never actually do it, but they're having that conversation with us. But then maybe they're going to their counselor and saying something completely different, or at least that's the vibe we're getting. Thoughts there on that?
Absolutely. When in doubt, go with your gut. And so if you don't feel comfortable and you're like, I don't feel comfortable sending this person home, then don't. Okay. So we are not licensed mental health providers. And so if you feel like you can't parse out, is this person safe or not, then you need to connect them with something with a place or a person that is safe, like the local hospital. If the therapist is on call the therapist, and they'll make the call. So that is common, by the way. I've had athletes say, I don't tell my therapist this, but I'm telling you this. And then the conversation of that can't be the case. I can't help you, and this is not appropriate. You need to tell your therapist this, right? And so you have to be, stern about that because, we need to draw the line. And so if you're not comfortable, absolutely, you refer and take them to the hospital. The other thing is that you, with time and having these conversations, you will get better at having these conversations and recognizing what's an emergency and what's not, right? The first time that you have a patient down on the field with a potential C-spine, you're like, they broke their neck. C1, C2, it's got to be that. And no, it wasn't. They have some trap spasm and that's about it, right? So that's okay, but we still spine boarded them and sent them for an x-ray because we don't want to be wrong, right? And, in that kind of case. And so same thing with mental health. And this will, it will get easier the more that you practice it and the more that you implement this and have these conversations.
Yeah. That was a great analogy.
Yeah, I like that.
Well, this is going to be a really difficult transition as we went from some really serious conversation into let's lighten it up a little bit here, and let's do the lightning round. We always enjoy doing that, especially with our athletic training guests. And so let's jump into it. Again, really weird transition, going from one to the next, but. So I know you mentioned it earlier that you love Westchester and that you plan to be there for a while. But if you could pick any dream job out there, what would it be? And it can be your job that you're currently in, if that's your dream job.
You know what? I know it's so cliche, but I love my job. I get to do everything I want to do. I'm in the cadaver lab teaching cadaver. I'm, teaching about mental health and sports psych courses. I'm researching mental health and I'm implementing mental health and working clinically hands-on on the field with my rugby athletes, with my women rugby athletes. And so I have the dream job. I love it so much. I'm not going anywhere.
Awesome. We love that answer because we get it more often than we don't, which is really, reassuring for athletic trainers that, hey, here we are. We love what we do. So we can appreciate that answer.
This is my dream job right here.
I love it. That's my second dream job. Being a mom is what I'm doing too. So I love that too.
So what do you do for fun?
I love to hike and ski and read when I get the time because, again, I have two children, a 3.5-year-old and a 1-year-old next week. So, free time, but exercising, cycling, hiking, reading, those are my fun things, and spending time with my family. I just love it. Travel. Actually, this summer, I'm traveling across the state of Utah to the Mighty Five National Parks in an RV.
Awesome.
So, yeah,
you're going to love it. It's going to be fun. Bring plenty of water. If you hit Zion, bring some shade.
We're doing Zion. We're bringing water and shade for sure.
Shade, definitely shade.
So, Lindsey, a little bit more serious again. What inspires you?
That's a hard question. There's people inspire me. I think the biggest thing is specific people, especially women and people who have been through struggles, people of color, and my athletes inspire me too. Anyone who's been through a struggle and is willing to speak up about it and talk about it really inspires me and keeps me going every day. And my children inspire me too because they're just beautiful little humans.
And the last question, something we've built entire episodes around. What does it mean to be an athletic trainer to you?
Being an athletic trainer means passion and providing access to healthcare, sometimes in situations where people might not even have access, right? When I was working in Philadelphia for some time with a few high schools in North Philadelphia, and some of these athletes that I worked with, I was the first healthcare provider they had seen in years. They didn't know what an athletic trainer was. They called me Nurse Lady. They didn't really know, but I helped them learn, and really I learned way more from them than they learned from me or than I helped them. So, people going through about their everyday life really inspire me, and that's what athletic training is all about, is connecting with people and access to healthcare.
I love it. I love it. Yeah. That's athletic training right there.
We love good mic drop moments.
I love that.
Well, Lindsey,
can I provide one more thing? One more thing that I would love to wrap up with. One other resource, 741-741 is the crisis text line. So memorize it. And maybe that will help even some of our listeners, because as athletic trainers, we struggle too. We're human, and so self-care is really important. Exercising, getting into therapy, time, balance, work-life balance, all of those things are really important. Self-care is important. So memorize that text line. There's also you can Google the suicide lifeline number. The text line's so easy, and so you can text home or help to 741-741. It's a great resource.
Awesome.
I think you just might have got yourself invited back for another show at a later date.
You stole my
time.
Awesome. This is definitely going to be another show for athletic trainer mental health.
I would love that. I would love that.
For sure. But okay. Let's wrap up, Lindsey. This has been great. Like, absolutely, this information is definitely important, and I'm so glad that you came on the show and shared your expertise with us. If viewers have any questions specific to you, do you mind sharing some resources for yourself to reach out?
Absolutely. You can find me at Lindsey C. Keenan, Keenan @gmail.com. Perfect. And that's Lindsey with an E. Lindsey with an E.
All right. Awesome.
You can find me on LinkedIn too.
There you go.
Great.
There we go. We got it.
Thank
we got
you
it.
so much.
And I'm going to call you Dr. Keenan because I just feel like I have to. So Dr. Keenan, thank you so much for coming on the show. And I want to say a big thank you to Rothman Orthopedics for sponsoring this episode. And to our listeners, thanks for tuning in. Remember to like, subscribe, share, tweet, post, comment, and DM. Until next time, I'm Adam Richmond.
And I'm Philip Hensler.
And this was the Pats Podcast.
Yeah. Thank you.